Hey guys, it's your favorite pipeline nurse practitioner. I just wanted to talk about anti-inflammatories today, actually, because so many of you guys have pain. Anti-inflammatories, there's four major ones that I think you're probably most familiar with. Aspirin, that is a COX-1 blocker. And what that means is during the platelet clotting kind of cascade in your blood, it blocks the platelets from sticking. So that's why they recommend it for heart attack prevention. That one is pretty outdated for pain. It doesn't do much, and because it's so effective on your platelets, it causes bleeding. So when you take it, you bruise easier. Your risk for a GI bleed, a stomach bleed is higher. Aleve, naproxen, those block COX-1 and COX-2. Now, COX-2 is more inflammatory pain related. So because they're partially COX blockers, the GI bleed risk, the bleeding risk is less, but it's still there, and they are more effective for inflammation and pain. Aleve is the lowest risk for bleeding if you take it at the recommended doses, which is generally over the counter, 1 tablet twice a day. The next generation, which is purely a COX-2 blocker, and those are like meloxicam, Celebrex, those are the prescription ones, and they don't really do anything for COX-1, but COX-2, the inflammation pain, they work better on that. The risk for bleeding is less, but the risk for a cardiac event is higher. All anti-inflammatories outside of aspirin increase your risk for a cardiac event slightly. COX-2 have the highest risk because they don't prevent those platelets from being sticky, but they work better for pain. Additionally, they are all metabolized through your kidneys, so they can cause kidney problems long-term or in high doses. If you are eating tons of Aleve and Advil, your kidney and bleeding risk is high, and it means your pain isn't controlled, which when your pain is not controlled, it's a whole big problem. If it's better controlled on meloxicam or Celebrex, that's great. Your kidney risk, your bleeding risk is lower, but you have to know there might be a slightly higher risk for your heart to be impacted. So that's a discussion you need to have with your provider. But oftentimes, I see you guys in the clinic and you are eating anti-inflammatories, Aleve, all the over-the-counter ones like candy, and the risk of bleeding and your kidneys and all that stuff is so high that I will flip you over to meloxicam. And oftentimes it's very, very effective. Consider talking to your healthcare provider about meloxicam or Celebrex. Also keep in mind, all of those medications can increase your blood pressure. So keep an eye on that.